Good morning, I am Laurent Dortel. I am working at the Imperial College and I am from France. It is a mobility at the Imperial College for 2 years, and basically I directed the French National Reference Center for antimicrobial resistance. And so this morning I present a work on the rapid detection of polymyxin resistance using a Malditov test.
Good morning and hello, I'm Gerald Larrouy. I'm from Imperial College, lecturer since 2 years and a half, and I'm working also on this huge threat of antimicrobial resistance, especially developing new diagnostic tools. That's why with Laurent we set up these new technologies which is most available for most of the people, which Laurent now will explain more about what he has been doing with me and with us at Imperial College.
So basically there is this huge topic on polymyxin resistance which arrived nearly 1 year ago because we don't have any other treatments now to treat this extremely drug resistant bacteria which are carbapenemase producer. However, we still don't have a very rapid test to detect the patients that are infected or colonized with this bacteria which are colistin or polymyxin resistant. So we have to develop some rapid tools that could be implemented in every clinical laboratories to detect these patients. So basically we decide to use the Malditov, which is now available nearly everywhere in Europe, in US, but it's still used to identify bacteria, and there is so little application on antimicrobial resistance. And with these tools, we develop a technique which could be done in less than 15 minutes. Usually to see in a routine workflow of polymyxin resistance, it needs nearly 4 to 3 days almost. So it's reduced a lot the time to obtain the result and to say physician, okay, be careful, this patient has a bacteria which is resistant to polymyxin. But we go a step after of that, because on polymyxin resistance there is polymyxin resistance due to chromosome encoded genes, and there is no possible transfer from one strain to another. And there is also this MCR1, which is now really in the focus, which is plasmid encoded. And with MCR1, this resistance to polymyxin could pass from one bacteria to another. There is a strong transfer that could occur. So with this technique, we not only detect very rapidly the colistin resistance on a bacteria, but we could directly discriminate if this colistin resistance is due to a plasmid, MCR1, which is very threatened just because you have to manage the patient, have some infection control, put them in single room, and it costs a lot to an hospital, compared to chromosome encoded resistance, which is threatened for treating the patient, but less threatened in terms of infection control.
And what is very important is that we have the knowledge about how the mechanism of resistance is happening, and combining the knowledge you have acquired over the several publications and decades of research to understand the bacteria, the mechanism of resistance, and combining with what is really needed right now with a huge threat of antimicrobial resistance and colistin, we have something we can deliver, a rapid test, cheap, efficient, available for most of the lab. And it's what here we wanted to show and present this morning.